Hi everybody in Psych 101. It's chapter 12 today, or whenever you're watching it, and the chapter is Abnormal Psychology, Psychological Disorders. Don't tell anyone, this might just be one of my favorite chapters to cover because I also teach Psych 266, Abnormal Psychology. So here we go. The first thing that we need to determine as psychologists, what is abnormal in the first place? So, 4 criteria. The fourth one, honestly, is the best one. You can follow along in the book, or with the skeleton notes, or with the PowerPoint slides. First way to determine norm violation. If you're doing something, saying something, feeling something, thinking something that society says is not normal, well then you would be violating a norm violation. So before all this pandemic stuff started, shaking hands was the norm when you meet someone. Well, maybe that will change. So this is why norm violation is not the best way to diagnose people. Things change, cultures are different, there's a lot of reasons. Statistical rarity. What if there was just a number score? Like an intellectual disability is an IQ below 70, that's a number score. Well, the problem with this is number scores don't explain everything. They're good and useful, but not all the time. Personal discomfort. You think you have a disorder? Well, you do. You don't think you do? Well, then I guess you don't. Well, that sounds nice, but sometimes people don't realize when they have a problem. We do let people self-diagnose things like insomnia and even some sexual issues if they say that they're having a problem, but most of the time it takes an expert to tell you if it's really bipolar, if it's autism, if it's schizophrenia. So what do we use? Maladaptive. That's the best way to diagnose people. Your symptoms are clearly interfering with your life, causing you problems. There is evidence of that. We would say you have a disorder. Insanity. I want you to know that insanity is not a psychological term, it's a legal term. So as a psychologist, I might tell a judge what the person's symptoms are, and even tell a judge, yes, that's schizophrenia, or something like that. But it's up to the court to decide if it's insanity. The person has no self-control and doesn't know right from wrong. So psychologists don't determine insanity, courts do. The DSM-5, I should have had it with me. I left it at the office and I can't go to the college right now to hold it up and show you. That is the diagnostic manual, nearly 1,000 pages of information that we use to diagnose people. It's in the 5th edition. About every 20 years we come up with a new edition of the Diagnostic and Statistical Manual. DSM-5 is what we're at right now. Let's go over some of these disorders. This is where it gets interesting. First category, anxiety and anxiety-related conditions. In the DSM-5, they're separate chapters. It used to be one chapter, but let's go over them anyway. Panic disorder. Having a panic attack is a miserable feeling. You might feel like you're going to die, choke, pass out, faint, and then it goes away as suddenly as it comes on. If you keep having these panic attacks, it leads to panic disorder, and one of the more common symptoms, agoraphobia. You become afraid to go anywhere because you're worried about a panic attack. Generalized anxiety disorder. Feeling constant stress, worry, anxiety for 6 months straight. We don't diagnose it until it's been 6 months because maybe a person is having a bad day or a bad week. 6 months, you've got a problem. Phobic disorder. Phobias are irrational fears when you know that you shouldn't be so afraid of whatever it is you're afraid of. People are afraid of all kinds of things. Spiders, snakes, elevators, but the number one phobia is what we call a social phobia, public speaking. That's what I'm doing now. Good thing I don't have that problem, huh? That's the number one phobia, public speaking. You know it's irrational, but you still have that fear anyway. Obsessive compulsive disorder. The obsession is the thought, The compulsion is the behavior or the action. So, hand washing. Yes, when there's a pandemic, it makes more sense than ever, but there are some people who will wash their hands hundreds of times a day or shower hundreds of times a day when it's uncalled for. Checking the locks on your house, your car, your windows at home, unnecessarily over and over and over again, those are common forms of obsessive compulsive disorder. The thought leads to the action. And the last one, post-traumatic stress disorder. A traumatic event makes the person have nightmares, flashbacks, avoiding situations, constantly thinking about bad things that have happened. Post-traumatic stress disorder. Next category, mood disorders, depression and bipolar. There's really only two directions your mood can go, up and down. Well, let's talk about down first, depression. People can get so bad with their depression, they become suicidal and feel hopeless. They feel worthless. They're in a depressed mood. They're sad and upset all the time. They feel like crying or they do cry. Here's what I want you to know. Anhedonia is the number one symptom. That is Latin, well, it's Greek too, for lack of hedonism. You don't want to do anything fun. That's the symptom we look for above and beyond all the others, but yet every symptom is important. Just know that anhedonia. And also know that 2/3 of the cases diagnosed are women. And we don't know exactly why that is. Is it hormonal? Is it what we call multiple roles? A lot of pressure to be good at a lot of different things, to look good, to be a good employee, to be a good mother or daughter. Maybe it's all the stress. Maybe it could be related to the way society treats you. Maybe women are willing to admit it more than men, that they're depressed, and that's how we know how many cases there are. Could be a bunch of factors. When I talk about this in class, usually there's at least one female who jokes, maybe it's the guys who make us depressed. Well, maybe. Could be all of those reasons, huh? The other extreme, that's low. High is mania. When people get alternating episodes of mania, even if it comes in the form of being angry and agitated, and then they get really depressed, and then they get manic again, bipolar disorder. We're not talking about something that occurs over minutes. Cycles take days, weeks, or months, and it's really debilitating for many people. Bipolar disorder can manifest when people lose touch with reality. We're going to talk about schizophrenia. It's a little different than that because eventually they'll go back to normal and then back to being depressed. It cycles. It's equal with men and women. Not exactly 50-50, but pretty close. It often starts in one's late teens or early 20s. Pretty rare to have bipolar as a child, but it's possible. Also rare for it to start in your 30s or 40s or later, but it's possible. Late teens and early 20s. And then the last thing is, it's bad news, if you get a cycle like that, it's likely to come back again. But at least you'll know what to do about it. You'll know that you need your medicine, you know that you need help. So it is recurrent about 90% of the time. 9 out of 10 people have more than one episode. Schizophrenia, being out of touch with reality. There are 5 symptoms, but the important ones to know especially, delusions. You believe things that simply are not true. People might believe they're somebody famous, like the president, or Jesus Christ himself, or you might believe you have secrets that nobody else has, or that people are talking about you through telepathy. People have all kinds of delusions that just do not make sense to the rest of us. And hallucinations, one of your 5 senses playing a trick on you. The most common one, hearing voices. When you see movies and people with schizophrenia see things, it's possible, it's just rare. Hearing voices is much more common. We also see disturbances in speech, disturbances in behavior, and what we call negative symptoms. People with schizophrenia often lack things like eye contact. They might lack social skills. They might lack words, they're kind of mute, or they have what we call a flat affect, no expression on their face at all. Those are negative symptoms. So all 5 of those things make up schizophrenia. You have the negative symptoms, disturbance in behavior, disturbance in speech, and then you have the 2 more important ones, delusions, false beliefs, and hallucinations. One of your 5 senses playing a trick on you. Somatic disorders. You think something is wrong with your body when nothing is wrong with your body. The one I want you to know for the next exam, conversion disorder. This is a very strange condition where a person takes psychological pain and converts it into physical pain. But we're not always talking about pain like something hurting you. It might be paralysis, it might be blindness or deafness, and your brain really has you tricked into thinking that that part of you is not working. So you go completely blind for no medical reason, but yet you're going through a breakup. Maybe your brain is playing a trick on you. One of the biggest symptoms of conversion disorder, and again, it's the only somatoform disorder I need you to know. Biggest symptom, la belle indifférence. If you don't speak French, well, neither do I. But I know this trait, this symptom, it is a lack of concern. Imagine that. Right now you go completely blind or deaf or paralyzed. Wouldn't you freak out about that a little bit? Or more than a little bit? Well, people with conversion disorder often seem like they don't care. They're like in a fog about it. Dissociative disorders. Part of your mind is splitting apart from itself. How could that happen? Well, we already talked about amnesia. That's a dissociative disorder. It's your memory that's split apart from the rest of you. You usually forget things you should remember and things that are unpleasant to remember. That's usually how amnesia happens. In TV shows, you forget your whole life. That's rare. It's more common that you just forget things, not everything. Dissociative fugue. This is often known as traveling amnesia. Someone who has this condition, what they often do is something very difficult or traumatic happens and they flee the area. So you go through a breakup or your house burns down or something, you might find yourself the next day in California or Colorado or Utah or New York, who knows? And then you wonder, how did I get here? And you don't even remember anything that's happened. If those 2 aren't unusual enough, dissociative identity disorder. This used to be known as multiple personality disorder. You have more than one personality that pops up and takes over your body. So you know me, I'm Scott. But what if I have alternate personalities that think they're someone else and they take over my body every once in a while? The real me is the host, I'm Scott, and the other personalities are the alters. That's what they're called. So, used to be multiple personality disorder. Next category, sexual disorders. And yes, this is college. I'm allowed to talk about this stuff. 3 that I want you to know. There is an entire chapter. There are many. These are the 3 for the exam. Ready? Exhibitionism. Flashers, that's what we're talking about. But not that you're changing in a locker room or you're on a nude beach. That doesn't count. You want to startle people in inappropriate situations, and startling them is the sexual excitement. Voyeurism. You've heard of peeping toms? Watching people. And it's not just opportunity that you're out walking the dog or anything like that. No, these people spend an incredible amount of time and money to get themselves into a situation which can even be illegal, like hidden cameras and things like that, to spy on people who are naked or in sexual activities or anything like that. And the last one I want you to know, fraudurism. This is when a person gets sexual excitement from rubbing up against you, grinding against you, touching you inappropriately. Creepy, isn't it? Well, People who have this problem, where do they go where they think they can get away with it? Not college classrooms. You would know exactly who did it to you. Well, here in your notes for the week, it's an attachment on Canvas, is one study that was done, New York City subways. Not at all a surprise to me, because those places get so crowded with people. Nightclubs, ball games, concerts, that's where people often go who have this psychological disorder where they think, no one's gonna know it was me. Moving right along, personality disorders. There are 10. You only have to know 3. You're welcome. 10 is too many to memorize. But anyway, for your whole life, your behavior is maladaptive. You have trouble being flexible and changing yourself. It's stable. You're not getting better or worse. It's chronic. You've been this way since you were a child. And it's pervasive. You act like this in a variety of situations. That's why there is this handout, because it describes the symptoms. The only 3 personality disorders I need you to know for the exam are in the skeleton notes, which is attached, of course, like usual, and it's in the PowerPoint. Narcissistic. If your personality disorder is you're so self-centered, you only think of yourself, you have no empathy for other people, narcissism. It comes from Greek mythology. You probably know people like that, right? We all do. Histrionic, overly emotional, including being flirtatious. You need to draw all the attention to yourself. Is it cute for a 3-year-old to do something and say, hey, look at me? Sure. But what about a 13-year-old or a 23-year-old? The older you get, it's no longer so cute to draw attention to yourself with your emotions. Histrionic. And the last one, antisocial. People often confuse this word with asocial. There's a disorder for that too called schizoid, but you don't need to know it for the test. Antisocial, against society. You lie, cheat, steal. You don't mind harming people. You'll do anything to get what's best for you. These are the dangerous people in society, antisocial. So the next time your friend says like, oh, I don't want to go out to the party tonight, I'm being antisocial, you can correct that person, right? It's asocial or even schizoid. Antisocial is against society. These are the criminals of the world. And last thing, childhood disorders. There are so many, but you only need to know one. And I'll tell you what, I'll post a video that we would have watched in class of a kid who's probably about 10 or 11 years old having a complete meltdown. I don't even need to meet this kid. I saw it on YouTube. It's disruptive mood dysregulation disorder. The kid is usually depressive, unhappy, sad. Nothing really makes him excited and enthusiastic, or her. But then when this kid gets pissed off, look out. They have tantrums, and you just feel like you're walking on eggshells around a kid like that. Disruptive mood dysregulation disorder. So we don't diagnose this until it's at an age where the kid should have self-control. You've heard the terrible twos, tantrums. We're not talking about that. We're talking about a kid that is old enough to have emotional control. Sexual disorders. Did you notice that that's mostly guy things to do? Unfortunately, that's true. Well over 90% of people with those disorders are males, not females. Don't know exactly why that is. Testosterone, or the way we socialize our kids, I don't know. But those are some things to know. Okay, that's it for this chapter, and the next one will be on the topic of therapies. Take care.